Good morning. Welcome to another lecture for pharmacology for healthcare professions. So after this lecture, you should be able to identify 5 sources of drugs, contrast systemic and local effects, define pharmacokinetic processes in the passage of drug throughout the body, state conditions that may decrease the effectiveness of each pharmacokinetic process like absorption, distribution, metabolism, excretion, discuss several variables that can affect drug action, define various drug action reactions, and describe the various routes of drug administration. So sources of drugs. Any chemical substance that is ingested or applied with the purpose to affect the body is referred to as a drug. So in earlier times, many of these substances were found in nature. So plants, berries, bark, leaves, excuse me, resin from trees and roots were considered a prime source of drugs, and they're still very useful today. A lot of these are just now lab created. Minerals from the earth that include sulfur, iron, potassium, silver, and gold are also helpful and utilized in manufacturing drugs. Synthetic manufacturing, so this is the genetic engineering with advanced technology, has opened the door for in-depth research and experiments, bringing forward effective and safe drugs, the ability to treat illness and discover cures for current medical problems. Research led to the use of substances from animals as effective drugs. Substances lacking in the human body can be replaced with similar substances obtained from the glands, organs, and tissues of animals. So we know that drugs are sourced from animals, plants, things found in nature, minerals. There's a systemic effect of a drug, okay? This is when it reaches widespread areas of the body because the medication reaches the bloodstream and is carried throughout the body. So an example of that may be taking Tylenol for a headache can assist with pain management in other areas of the body. So just because you're taking it because you have a headache, it may also help with maybe knee pain. Then there's a local effect. So this is limited to the area of the body in which the drug was administered. So an example for that would be a topical cream will only work on the area in which it was applied. So talking about pharmacokinetics, this is a process which the drug moves through the body. So when a drug enters the body, it undergoes many changes along the way. The 4 drug processes are absorption, distribution, metabolism, and excretion. So absorption is the passage of the substance through a membrane into the bloodstream, whether that is through the GI, through an IM injection, or intravenous. Distribution, so moving from the bloodstream into the tissues and fluids of the body. Metabolism, physical and chemical alterations that the substance undergoes while in the body. And then excretion, how is it eliminated? So eliminating waste products of the drug metabolism from the body. This chart here just has some examples. So for absorption, this is usually the mucosa of the mouth, the stomach, the small intestine, or the rectum, blood vessels in the muscles or subcutaneous tissues. Conditions that can alter this process: incorrect administration may destroy the drug before it even reaches the bloodstream or its site of action, like giving certain antibiotics after meals instead of on an empty stomach. Then distribution. This happens through the circulatory system, through capillaries across the cell membranes. So things that can alter this process would be someone's poor circulation. This can prevent the drug from reaching tissues where it is to have the desired effect. Metabolism. So this happens mainly in the liver and small intestine. So conditions that can alter this would be hepatitis, cirrhosis, any liver damage, can prevent adequate breakdown of the drug. And this causes a buildup or an accumulation of the unmetabolized drug and can cause toxicity. Then there's excretion. So we excrete through the kidneys, sweat cells, lungs, or intestines. So if a person has renal damage, kidney failure, this can prevent the passage of drug waste products and therefore an accumulation of drug in the body causing a toxicity. There are many variables that affect how quickly or successfully a drug goes through the body. If any of the 4 processes are altered, then the drug action and effect will be altered. So the site of absorption also varies according to the physical properties of each drug. So when we talk about absorption, pH is a factor. So acidic nature of drugs are absorbed well within the acidic stomach environment. Alkaline pH drugs are not absorbed well through the stomach, but are absorbed in an alkaline environment of the small intestines. Then there's some drugs that are lipid or fat solubility. Substances high in lipid solubility are quickly absorbed through the mucosa of the stomach. Alcohol-contained substances are soluble liquids. They rapidly absorb through the gastrointestinal tract. Substances low in lipid solubility are not absorbed well through the stomach or the intestines, but they're absorbed best when given by means other than the GI tract. Presence or absence of food in the stomach. So food in the stomach tends to slow absorption due to slower emptying of the stomach. If a fast drug effect is desired, an empty stomach will be best for providing quicker absorption. Some medications on an empty stomach is contraindicated though, as the medications can irritate the stomach and are better buffered out by the process of food. With distribution, so this is a movement of the drug through the bloodstream and into the tissues and fluids of the body, can also be affected by specific properties of the drug reaching major organs and may depend on the drug's ability to cross the lipid membranes. Some drugs pass the blood-brain barrier to reach the brain. Some drugs have selected distribution, and this refers to an affinity or an attraction of the drug to a specific organ or cell. So an example of this, an amphetamine has a selective distribution to cerebrospinal fluid. When drugs are metabolized, particularly in the liver, a drug is broken down and altered two or more water-soluble byproducts with this. The drug can be more easily excreted by the kidneys. So some drugs are inactive when they're administered, and they become active only when they're metabolized by the liver. This group of drugs is also known as prodrugs. It is possible for some drugs to bypass the process of metabolism, and when that occurs, they reach the kidneys virtually unchanged and later can be detected in the urine. Excretion. So most drugs are excreted by the kidneys and then by, urinating. It's possible that some drugs are eliminated through the lungs, like exhaled gases, or through perspiration, feces, bile, and breast milk. If a drug is not excreted properly before repeated doses given, the drug forms a buildup which is called a cumulative effect. A cumulative effect is an increased effect of the drug that is demonstrated when repeated doses accumulate in the body. When too much of that accumulates, toxicity can occur. Toxicity is a condition that results from exposure to either poison or a dangerous amount of a drug that would normally be safe when given in smaller amounts. In drug therapy, the goal is to give just enough of the drug to cause the desired therapeutic effect. Other variables that can speed up the effect or the efficacy of drugs being processed by the body include age, physiological state, weight, other drug interactions from taking more than one drug, gender. Sometimes women respond differently than men do due to body fat and hormones. And then, of course, the dosage. Dosage can bring about variations of the drug such as speed, action, or effectiveness. Dosage is defined as the amount of the drug given for a particular therapeutic or desired effect. The minimum dose is the smallest dose that will produce the therapeutic effect, and the maximum dose is the largest amount that will produce a desired effect without producing toxicity. Then there's a maintenance dose. So this is the dose required to keep the level of the drug in the blood at a steady state to maintain the desired effect. When there's too much of it, it becomes toxic. So a toxic dose is the amount of a drug that will produce harmful side effects or symptoms of poisoning. And then there's a lethal dose. This is a dose that will result in death. Optimally, a therapeutic dose is what we want. This is a dose that is customarily given and adjusted according to variations from the normal, like adult dose based by body weight, but keeping it at a therapeutic dose and level. That's our desired effect. The route of drug administration can have an effect on the speed of drug action. So there are several methods that a drug can be given to reach their desired effect. We talked about those in a previous lecture. The most common routes of administration are grouped together within two main categories. So the two categories are enteral or GI tract routes. That's your oral medications, medications by an NG tube, or rectal medications. And then we have parenteral routes, which are by injection, whether it's intravenous, intramuscular, subcutaneous, intradermal, intracardiac, or intravenous. And then there's non-parenteral, which is sublingual, transdermal, topical, ophthalmic, otic, transvaginal, nasal, and inhalation. But these are the two categories. So you have enteral and parenteral. Routes of drug administration. So we talked about this in the previous lecture, but there are advantages and disadvantages of various administration routes, and the physician will decide the route that's best based on the desired effect, the absorption quality of the drug, and how the drug is supplied. So oral route is generally the easiest. However, the effects are slower because of the time required for it to dissolve and go through the GI tract. Intravenous route is, of course, the fastest because it enters the bloodstream immediately, but obviously not available to people in their homes for the most part. Parenteral routes are chosen when the patient cannot take a medication by mouth or the drug is not suitable for GI absorption. Other points to remember regarding the route on drug absorption are intramuscular route is rapid as muscle is highly vascular. So intramuscular may be the option if the intent is to slow the speed of absorption. Transdermal route allows for slower, consistent drug absorption over time. Inhalation is fast acting due to the large surface area of the lungs and the rich blood supply in which the drug is allowed to enter the bloodstream. Adverse reactions are unattended effects of a medication, and we call them side effects. So this can occur for many forms, including cough, pain, tremors, headaches, dizziness, photosensitivity, lab value changes. But when a harmful side effect occurs, it's termed as an adverse drug reaction. And many times a change in a drug dose or frequency is needed to prevent it. There's some different terms on here. Tetragenic effect is the effect from maternal drug administration that causes physical defects in a fetus. Idiosyncratic reaction is a unique or unusual expected response. It's not something that's in the norm. Paradoxal reaction is the opposite effect from what is expected. For an example, an agitation effect versus a tranquility effect when taking tranquilizers. Sometimes when people take Benadryl, it'll make them very energetic, whereas other people take Benadryl and it makes them sleepy. Tolerance is another one. This is a decreased response to a drug that develops after repeated doses are given. Dependence can produce physiological or psychological symptoms of withdrawal, which can include nausea, tremors, sweating, pain, and retching or vomiting. Hypersensitivity is an immune response to a drug that can be mild with no immediate effects. It's more likely to exist in patients with other known allergies. Anaphylactic shock. So this is a severe, possibly fatal allergic response. Signs can be mild or severe, can include itching, hives, vascular collapse, shock, cyanosis, and difficulty breathing. In that case, an EpiPen is utilized to treat severe allergic reactions. Thank you for listening. On to the next lecture.